All right. Hey, everyone. My name's Edwin. I'm one of the fourth years. Hopefully, you know me by now. Um, when thinking about a topic to do for senior lecture, I knew I didn't want to do anything about any specific medical topic or reviewing any sort of guidelines. I kind of wanted to do something that would be at least would apply to everybody, and to each year, to each class. So I kind of was just thinking, back on the last 4 years here that have honestly been too fast and been quite a blur. And just reflected a little bit on kind of things and tips, and tricks that I wish I knew kind of at each year and each stage, and kind of what to look out for as you're jumping into the next year. And so that's why I decided to make my senior lecture on things I kind of wish I knew, or things that I should have prepared for coming into each new year. Um, Disclaimer though, this is obviously all just based on my experiences. This is based on people more senior for me that I learned from. And so you can always feel free to ignore anything that I say, because at the end of the day, it's just my opinion. But hopefully I provide some small tidbits that might help each of you guys as you move forward throughout residency. So we all began like this. This was the first, I think this is the first week of orientation when we all took our photo. We all started in the same place. So I remember being an intern and just looking at the fourth years and being like, how the hell in 4 years am I going to have that ability to even just see patients like that and just think as quickly. And the thing is, it happens before you know it, and the amount you learn throughout residency is just kind of exponential each year. And it's just something that I've grown to appreciate, and I know it's going to continue to grow even more, especially that first attending year. I know everyone says is a tough year, but we all started at the same exact place. So just know that it's 100% possible, and that every 4 years, a whole new class graduates, and kind of the cycle will always kind of continue, right? The residency timeline in my eyes I saw it kind of like this, right? Intern year, I kind of just saw it as learning the ropes, just trying to get my feet grounded and kind of just make it through that year. PGY2, I saw it more as kind of surviving off services. To me, that was one of the probably toughest years, and I know my PGY2s currently probably agree with me. It's not a fun year at all. PGY3 is just kind of when you start developing your own kind of way of doing things, and when you are get the first taste of being a senior, which comes with its own pressures, with its own changes. But that's kind of how I saw the third year. And then the fourth year is when you start doing this pre-attending and kind of start morphing into not just working with your own patients, but starting to deal with kind of the entire room, and starting to think about how in the future you're going to deal with managing an emergency room wherever you end up. So intern year, I actually started off with Sarah. It was me and Sarah. We started off in the ICU. And so starting off in the ICU, this is really how I felt, right? I had just graduated medical school. We started during COVID. And so I had pretty much like 4 to 5 months of like nothing medical done. And so this is kind of how I felt starting the ICU, and being the doctor, especially over on night shifts, whenever a nurse would ask me something, this would be kind of the face I would feel internally. And I would always refer to my senior at that time for sure. But the most important thing that I learned throughout intern year, and what I would say to all the new interns, to the interns that we have now, who I'm sure are kind of already about to be PGY2s, right? The most important thing would be to just the initial things that I wish I focused on was just to focus on really the basics, meaning not to stress yourself, at least definitely in the first 6 months, on patient volume or on how fast you're seeing patients, but more so on the actual good care that you're taking. And what that means is not cutting corners, taking good histories, doing full physicals, right? And if there's something you miss when you're asked during your presentation, to if you didn't do it, be honest and then just go back and do it, because that's the beauty of what we do. We can always just go back to the bedside and either repeat an exam or ask further questions. The other thing, in addition to kind of focusing on the basics, is just really learning the culture and the systems in place, which I think our new interns are kind of now at the point where they know how the flow of the emergency room goes, whether it's at county, whether it's at downstate, how the cultures at each hospital differ. And that's just something that I definitely, throughout my intern year, was something I reflected on, and was happy that I kind of started to focus on. Additionally, was asking for help. So whenever someone you think is sick or something it goes different than what you were planning and you have a question, there's always people around, whether it's your senior, whether it's your attending, whether it's your co-intern, whether it's anyone else pretty much in the team, there's always somebody that's going to be available to answer any of your questions and to help guide you in case something is going in the worst direction. So that's something that also I would definitely say to focus on. And it's something that, to be honest, throughout my 4 years, it's only gets more important because the more senior you get, the more you realize there are going to be limits as to what you can do and that you are going to have to ask for help, even from other attendings or from other people around you. And kind of going hand in hand with this, it's about learning your team, which I think now after 4 years here, you do get a really good sense of kind of which nurses are the ones that you can rely on, which techs, aka Mark, you can rely on to get stuff done, and kind of just learning the team and learning how to best utilize everyone to make it the most efficient possible is a skill that you can start as early as intern year. And then this one is really more for the current interns right now that are pretty much PGY2s is, appreciate your growth. The amount of stuff you have learned in this 1 year is actually something to be very proud of. You might not feel like it is, but especially when next in a couple months when the new interns come and start and you start talking to them, you're just going to see how much you've grown in this 1 year. And you're going to be the ones that are going to be able to help these new interns kind of get assimilated and get used to everything that, we deal with in this crazy environment of the emergency room. But take a minute and, I know the year is still not at an end, but appreciate kind of everything that you guys have gone through and moving on to the next step, right? Which of course is PGY2. So PGY2 for me was one of the roughest years just because of all the off services, dealing with the schedules of the off services that often, with a lot of ICU time, you're working a lot more in a row. And then also just being away from kind of the people that of. So this is mostly how I felt in PGY2. I felt like everything around me was just chaotic and I just kind of was like, this is fine. I just have to continue going forward. The first thing that I would say is the most important about PGY2 is helping out your fellow interns, right? So your new interns that are going to come around, especially these new soon to be PGY2s, you guys, the new interns that are going to come are going to have the exact same questions you guys had when you started, whether it's anything as small as how do I order this versus what number do I call to get the lab, what number do I call to get X-ray, etc. This is going to be, they're going to be the first ones to kind of reach out to you to do though. Also, you guys are the ones that are going to work with them on shift together more so than us as the seniors, since we only really work one senior at a time on one side. So it's important to just remember that you were in that position before and to kind of start helping out in any way that you can. Second year, I think, is also a good time to start forming kind of your own algorithms of how you deal and approach patients. And this is something in all 4 years you're kind of working on, but I think second year is a good place to start solidifying this, more so because you already have the experience of learning the culture and the system in the first year, and so now you can kind of build on top of it. And what I mean by your algorithms, whenever I've spoken to a few of you guys when I'm pre-attending with you, it's your way of how you approach a patient and kind of how you already have a framework in mind of what you're going to do even before seeing them based on their chief complaint, whether that's their chest pain, the shortness of breath patient, the altered mental status patient, the hyperglycemic patient, etc. And it's not to say that these algorithms you have to follow them 100% of the time, but they're helpful in kind of focusing your history and getting you a little bit more efficient, and also in order to make sure you don't miss anything depending on each patient that you see, which is, I think, the more important part. And additionally, in second year, I think is also a big year to start thinking of just past the initial workup. And this is also more attributable now towards our current PGY2s who are about to be threes and are about to become seniors, is to not just think about the initial workup and what you're planning on doing in that first hour while they're in the emergency room, but start thinking ahead, right? Is this patient going to be admitted? Is this patient going to be obs, discharged, transferred, etc.? And kind of what will hold you up in that sort of disposition planning, whether that's talking to family, transport, talking to consultants, getting extra imaging, etc. Right? Once you kind of start having this way of thinking, you're going to start to see that you're going to be able to start moving through patients a little bit faster as well, because you already know kind of what was expected in order to get them to ultimate disposition. And I think second year, especially near the end of second year, right now, when you guys in the next few months, this is a good time to kind of start practicing that in real time. And additionally, start to focus on the side of the room that you're at as well, right? Especially as an engineer, I would mostly just focus on the My Patients tab, and I would ignore kind of everything else. And that's okay to do in the intern year, but I think once you're reaching this end of the second year, it's important to start going away from that and start seeing kind of what the bigger picture looks like, especially once you become a senior, and when you're fourth year, when you're pre-attending, this is really what you're doing most of the time, is just focusing on the entire room and seeing kind of what else can be done to kind of help mitigate the delays that we sometimes inevitably have. And this is something you're going to do every year, and it's going to build up, especially in your third and your fourth years, but it's just something to start considering doing, and something that I was told by some of the attendees I work with to, start focusing on that tab instead of the My Patients tab. And then the last thing for my PGY2s, things will definitely get better. I think I felt the most burnt out at the end of PGY2 going into PGY3. But things do get better, specifically, the 8-hour shifts, the transition from the tens to the 8 hours is a big change in quality of life in terms of at least being able to do stuff outside after you finish work. The 12 hours on the weekends do suck, so I'm not gonna lie about that, and those are probably still really annoying to deal with as a four right now, but it does get better, and I believe third year and fourth year for me have definitely were drastically better than the first 2 years of residency for me, in my opinion. Then PGY3, right? Like I said, PGY, with the way I took a PGY3, this was kind of I was just recovering from PGY2 and then kind of going into senioring. So in all honesty, PGY3, I felt burnt out. If you spoke with any of my co-residents or anyone else, this is kind of where I think I felt my peak burnout. I was just tired. I was working all the time. And then now, on top of all of this, we were kind of thrust into senioring, which just made work more stressful, and especially in the beginning few months of senioring. And to my soon PG to be PGY3s, right? The biggest thing that always scared all of us as we became seniors was CCT, right? So CCT itself can definitely be intimidating. This photo is a photo I found on Google about CCT, and I've never seen the beds in this position, which I think is a good thing because they would be weird. The patients would be looking at each other. But CCT is a very intimidating place, especially in the first few months of you starting to be the senior there. But just know that you're never alone, right? Especially in the first few months, you're going to be your attendings will know that this is kind of your first kind of senior moment in the CCT, and they'll help you with that and rely on your attendings. But additionally, as you can see from the last few weeks, all the emails that we've been sending to each other, all the thank you emails, there's always going to be help in case things go crazy, and things will go crazy in CCT. It's always a hit or miss, but it's inevitable to have days where you're going to be overwhelmed, whether it's with tons of hallway clearance patients or actual sick patients coming in, or unfortunately a mixture of both that makes it even more difficult. But just know that you're never alone, and that with more experience, this is just something that you'll get better at, and knowing who to clear, who not to clear. And I think the biggest advice I can give to my PGY2s that are about to be threes is these next few months, especially focus on trying to run the room, practicing running the room with your fourth year. Speak with your attending, tell them that you want that to happen, just because this is something I did. I remember I worked a few shifts with other fourth years back when I was a second year turning into a third year, and they let me kind of practice running the room, and it gives you at least a little bit of sense of how it's going to be, which I think is very important. Additionally, in third year, which I'm sure now the current PGY3s are very aware of this, observation becomes a thing. And observation is something that, at least hopefully, I think maybe there'll be a lecture on it specifically now, but I don't know, Carly, you can tell me, but that we kind of just got thrust into it, and we're just like, okay, now you have an ob shift, so here you go, figure it out. And so I kind of felt like most of obs was mostly self-taught in my opinion. The good thing is most of this is protocol based, so it's not hard to get the hang of it, right? There's little nuances in terms of how, the style of notes you write and things to do, but the most important thing is if you're worried about how to work through OBS, all the protocols are listed on Clinical Monster, and they're pretty descriptive about the inclusion criteria, the exclusion criteria, et cetera. And additionally, again, rely on your attendings because they've been the ones who have been doing OBS much longer than you. And so if you have any questions, always ask them the questions that come up. Obs, I think, is a thing that in time you'll either end up hating it or loving it. I feel like that's kind of the dichotomy that ends up happening, but it is something that to just keep in mind, especially the soon to be PGY3s, to just know that that is something you're going to have to start doing, and maybe just taking a glance at some of the common protocols that we use often will be helpful down the line. And then additionally, I think in PGY3 year, this is kind of when I started to focus a little bit more on how I could become more efficient, right? Whether it was just how I wrote my notes versus how I stayed on top of the workups of all my patients. And this is going to be different for each person, but I think it's a good time to start focusing on that, especially moving into your fourth year and moving into post-residency life, kind of how you want to depending, especially if you're going to go to an RVU-based model where it is going to depend on how many patients you see. This is just something to start thinking about. And additionally, start thinking about what's next, right? Especially the end of third year right now, the current third years. Fourth year comes by really fast, and especially if you're doing fellowships, I know the match and the applications, they can be due as early as like November of that year coming up. So it's something to start thinking about. It doesn't necessarily mean that you need to have everything done, but it is something to consider moving in the next few months moving forward. And again, if you are interested in just pursuing jobs, job market is helpful to think about it early, just because ASAP is pretty early on. I believe it's usually in October, and by then you can always, if you already have been speaking to recruiters at ASAP, you'll actually be able to have sometimes on-site interviews and stuff like that. So it's the earlier the better. So it's just start thinking about kind of what comes next. And then PGY4, you finally hit the promised land. I kind of felt like this initially, right? Freedom. I was like, I can't believe it. We're so close to being done. The countdown began. Even though I haven't necessarily started a countdown yet, just because I think I still have 2 months left. So until then, I won't start the countdown. And this is normally this is how it felt like. But then now the closer it gets to ending, this is more how it feels like, right? It feels like the what Uncle Ben said, with great power comes great responsibility. And in terms of that great responsibility, it's your name on the license. And your name that's gonna be the one that everyone's going to ask for whenever anything goes wrong or when something goes right as well. So this is kind of how I'm in the framework of mine now. For my current PGY3s, most of them I know are cord, but the biggest change between PGY3 and PGY4 year is going to be the pre-attending role. So pre-attending itself also there's not much guidance, I would say, that you just get. You kind of just start your first shift and you kind of start seeing how you do. And the more you get used to it, the more you're able to kind of deal with it. I would say, some of my initial tips that I've learned over the last year of just pre-attending, and this kind of applies, I guess, to just getting yourself to become a full attending is, the first one is just seeing and examining every patient yourself. Sometimes this can be hard because you're going to get multiple presentations at once, but it's important to be able to actually see and examine every single one, because either depending on who's presenting to you, if it's a rotator, they might have missed something that you have caught on your exam or something like that, and it's important that you don't miss that. Secondly, developing some sort of framework that kind of keeps you organized. I know all of us have different kind of ways, whether it's writing things down on a note, nothing else, or creating lists or check boxes, whatever helps you just keep everything organized. That's something to consider. Again, kind of what I talked about getting down in PGY3, start anticipating kind of what's going to be required for the dispo, right? Sometimes your junior resident might not think about that, and as long as you do and you're able to kind of start that process, it'll make it a lot faster. And prioritize making the plans, right, with your juniors. I think one of the things I hated or I got annoyed at as a junior in pre-attending was that it would take so long to kind of confirm plans. So prioritize that, know that your team is kind of waiting on you to confirm the plan. So try to do that as much as you can. And then the last thing that I think what is helpful, especially near the latter half of this year, is start practice also seeing your own primary patients while still pre-attending. This is a harder thing to do, mostly because sometimes it's just so busy that it's not possible to do this. But it's a good way to start practicing how it would be like in the real world, where if you are at a community site, you might be getting presentations from NPs, from PAs, but you're still gonna have to be seeing your own patients as well. And I think this is a good safe setting to practice this in, where you still have your attending next to you that can help in case anything gets too overwhelming or anything gets too crazy. So these are just kind of some things to think about moving into your fourth year to the current PGY3s. I was going to talk about job planning, but I think Zach did a great lecture already, so I'm not going to run through this a little bit faster. The one plug I will say is there's so many resources. ASAP is obviously the biggest one. Practice Link is this other website that you can create kind of an online resume. You like put in all your info, and then it contains hundreds and hundreds of listings. And this is a way for recruiters to kind of start getting your information out there. And just be warned though, if you do this, your email and you're gonna get texts just about jobs randomly all over the US. And so if that's not something you want, then you can avoid that. And then lastly, I've talked to a few of the PGY3s about this already, which is this Facebook group called EM Docs Jobs. Just type it in exactly how it shows here. You have to request to be a part of it, but it's super helpful because it's just a community of emergency medicine doctors. They're very transparent about their job posting, so they won't allow people to post a job without a full explanation of the responsibilities, without a full transparent pay, benefits, scale, as well as everything like that. So it's very helpful. And additionally, every job post, you'll see people comment on it. And so it's good to see if sometimes if it's a really shady or bad deal, people won't be scared to shout it out and be like, this pay rate is ridiculously low. Why are you giving this? etc. So it's a very helpful tool. I would recommend that. I was gonna go into a few of the things to consider for job planning, but like I said, Zach already did a great job. Right. Again, I think location, like he said, is gonna be your first kind of thing to worry about, whether you want to stay in New York, whether you want to leave New York, etc. The type of job is also going to be important, whether you're thinking of community versus an academic versus locums, like he touched on. And then there's tons of other factors that I think Zach already focused on. And in terms of the interview trail, right? Interviewing, I actually found to be pretty relaxed for the most part. I think most of the interviews are just one-on-one conversations with the medical director. And it's really your chance to ask all the questions you have, right? So ask about the support staff, ask about the facility, ask about the consultants that are available, ask about scheduling and how far in advance it's done. And if you can, like Zach said, visit the site in person because that will tell you a lot. And most likely, depending on where you're interviewing, they will offer to fly you out and to pay for a one-night hotel stay, which is what I did to see a site in Austin. And it's a great way to actually meet the people and see them in person. And then kind of near ending my fourth year, the things that I learned, right, is that learning will never stop, right? I think even as a fourth year, there's still things that I need to read up on. And I know as an attending that I'm just gonna be moments where I feel like I'm gonna need to reach out for help. Obviously, the what beauty about the WhatsApp groups that we form from engineers that they last forever. So I'm definitely gonna be reaching out to my fellow PGY4s and attendings next year in case anything comes up. But I'm sure we others will reach out as well. But it's just something to know that learning will never end. And then the last thing to end my talk, right, is obviously my biggest kind of take home from all the last 4 years here is, we are in a specialty that unfortunately is probably the most burnt out specialty compared to everything else. We see large volumes, we see people at their worst. We deal with a lot of trauma, whether it's emotional trauma, actual trauma, and we have a very hard we have a very oh, whoops, sorry, I'm muted. We have a very hard like actual way of dealing with what we see. And most of the time we just focus on working, working, working and kind of finishing the shift and not thinking about how we can actually mitigate that burnout. So one of the things I've taken home from the last 4 years is really just make sure to enjoy your life outside of the shift. Have things outside of medicine that make you happy, whether that's traveling, which is something big for me, whether that's being with your friends, with your family, etc. Just make sure you focus because this is just the beginning of our career, right? We're just graduating residency. We can't, and if we're already burnt out at this point, we still have a whole career to start, and that's just not something that could be sustainable. So whatever that manifests in your own way. That's just something to always remember throughout your 4 years that you're kind of grinding through this, is that you always have to focus on something else outside of the actual medical job that we do every day, and what makes you as a person happy. And part of that is obviously for me was always my friends, my family, and my residency family, right? So this